I'm Mohsin Maqbool. I'm a pediatric neurologist and the medical director of the Pediatric Sleep Institute in Plano, Texas. Sleep disorder is essentially anything that would disrupt normal sleep. So in order to understand sleep disorder, you need to understand what normal sleep is. A sleep disorder is anything that comes in the way of normal sleep. Normal sleep is usually a combination of normal sleep duration and good sleep quality, and also when that sleep is acquired. Let's elaborate on sleep disorders. Let's say someone is not sleeping enough. They're sleeping 5 to 6 hours per night. No matter how good their sleep quality is, they're going to feel sleepy and tired during the day. On the other hand, if someone has a sleep disorder with their sleep quality, compromising the depth of their sleep and continuity of their sleep, no matter how long they sleep, they will continue to have signs of sleep deprivation throughout the day. If someone gets all their sleep during the day or takes a long nap and doesn't sleep enough at night, they're going to also have signs of sleep deprivation, fatigue, tiredness, and sleepiness. In children, sleep disorders present slightly differently compared to adults. In adults, sleep deprivation presents with sleepiness during the day or fatigue. Now, the signs of sleep deprivation in children vary from signs at night and signs during the day. Signs of sleep problems or sleep disorder at night include waking up frequently during the night, restless tossing and turning in sleep, snoring, choking, or gasping in sleep, bedwetting, or having nightmares, night terrors, sleepwalking, or sleep talking. Daytime symptoms of sleep disorder include being tired during the day, waking up tired, having dark circles, having difficulty focusing, concentrating in school, school teachers saying that the child used to do better in the past, but lately have not been doing so, and falling asleep in the classroom, and above all, at the end of the school day, requiring a nap. That's usually a telltale sign, especially if they're older than 5 years and require a daytime nap, is generally a sign they're not getting good quality sleep at night. Sleep disorders in children can be of various types. I will divide them into basically 4 categories. First one, we call them sleep-related breathing disorders, also known as sleep apnea. Signs of that include snoring, choking, and gasping in sleep, waking up, feel like you're not able to breathe. These are the symptoms. Signs of sleep disordered breathing include having enlarged tonsils, enlarged adenoids, having large-sized tongue, or low-hanging jaw or slightly open jaw, mouth breathing, foul smell in the breath. These are the signs of sleep-disordered breathing. Second category of sleep disorders in children, we call them as sleep-related movement disorders. For example, restless leg syndrome. These children continue to toss and turn and flip-flop in their sleep, taking away the quality from their sleep. Third one is considered circadian rhythm sleep disorders, where there's nothing wrong with the child's quality or quantity of sleep. Their sleep time is just set at a different time zone. It's just like having a jet-lagged child in your household. Another sign of circadian rhythm sleep disorder includes not being able to sleep at the desired time. Same child used to sleep at 9 or 10 p.m. the year before, but this year they cannot sleep until midnight or even sometimes past midnight. It's a sign that that child's circadian rhythm is naturally delaying. But clinically speaking, these children many times get misdiagnosed with insomnia. They get put on different medications, including melatonin or over-the-counter antihistamines, or sometimes even sleeping pills that obviously do not work. Fourth category of sleep disorders, let's call them sleep deprivation. Sleep deprivation caused by one's own behavior. Staying up late at night because a child is using their phone, or is up doing their homework in their bed, or having anything that we call as inadequate sleep hygiene. So in order to understand that, we need to know what sleep hygiene is. Sleep hygiene is defined as a set of behaviors in order to have optimal sleep. These include having a dark bedroom, slightly cooler, at least 2 degrees cooler as compared to during the daytime, not having heavy meals within 3 hours of bedtime, avoiding caffeine past 3 p.m., and not doing anything in the bed but sleep. Examples of good sleep hygiene: They are all in the word sleep. Start with schedule. Have a set schedule and go to bed at the set time every day and wake up at the same time every day. Second one, light. Avoid light exposure in the evening, especially after sunset. Blue light from electronics and iPads, they impair our ability to sleep at desired time. They naturally delay our bedtime. Blue light is an example of light therapy that I use in my clinic to delay somebody's sleep time. E. E stands for exercise. 15 minutes of aerobic exercise during the day really help promote depth of sleep and makes it easy for one to fall asleep faster. The second E is for electronics. Try to avoid use of electronics, especially that emit light. Xbox, computer games, iPads, laptops, they must be avoided in the evening time. Patients usually ask me, is it okay if we use the red light filter? The answer is not really, because the study was done that has shown no impact of the red light filter or the blue light filter on the ability to fall asleep. They both delay our natural sleep times. The last one, P, stands for practice what you preach. We can't just tell our children to put their phones down while we are on the phone ourselves. So this advice is for parents. So try to follow the directions and rules in your own household. You'll be looking for signs of disturbed sleep at night or impaired wakefulness or fatigue during the day. If this is something that has happened over the course of a few weeks, there is a chance that your child may have developed a sleep disorder in the meantime. These may range from sleep apnea to restless leg syndrome to delayed circadian rhythm or just have poor sleep habits. If you suspect that your child has a sleep disorder, I would start by quantifying their sleep. I would use a sleep log or any of the wearable actigraphy or activation watches that determine or quantify your child's sleep. These devices are pretty reliable when it comes to determining falling asleep time and wake up time. If a child is getting less than optimal sleep, maybe it is time to reorganize their nighttime routine so that they are able to get in bed and fall asleep at a desired time, taking away the element of sleep deprivation. If you suspect that a child might not be getting good quality sleep, it might help to record your child's sleep noises using telephone apps. There are several apps that actually record snoring sounds. If you find that a child is snoring, it's a good time to contact your primary care doctor to get referred for a sleep study to rule out sleep apnea. If you suspect that your child may have restless leg syndrome, which is if they complain of their legs bothering them, they feel funny, and rubbing on them, massaging them, or taking a little walk makes them feel better, they may have restless leg syndrome. 70% of children who have restless leg syndrome continue to toss and turn in their sleep, compromising their sleep quality. If that's the case, that's another reason to contact your primary doctor so they can rule out underlying conditions leading to restless leg syndrome. And just like we talked about sleep hygiene, try to follow sleep hygiene measures yourself and in your child. Because studies show that sleep habits at 13 years of age are the exact sleep habits at 30 years of age. If despite following sleep hygiene measures and doing everything that you can to help your child get a better quality sleep, the sleep problems persist and you suspect that your child is struggling and suffering from a sleep disorder, maybe it's a good time to get your child evaluated for sleep disorder. You can have your child evaluated for sleep disorders by contacting your primary care doctor or by contacting the Pediatric Sleep Institute directly. Amongst the informational material that you have been provided, one of them talks about the daily sleep requirement in children. Try to see if your child is getting the optimal amount of sleep, which is in the middle blue box. Sleep debt is how we accumulate lack of sleep on a day-to-day basis and how we pay it back. Let's say a child needs 8 hours sleep every night, but they get 6. So over the course of 5 days, they're going to accumulate 10 hours of sleep debt. The question is, how do you pay back that sleep debt? That sleep debt is paid back by sleeping 2 nights of extended sleep. Extended sleep is defined as their daily sleep plus 1 to 2 hours. So by sleeping 9 to 10 hours on Saturday and Sunday, they'll be repaying their sleep debt accumulated over the prior week. According to World Health Organization, sleep deprivation is an epidemic. The advent of technology and easy access to electronics and light-emitting objects has made lack of sleep and poor quality sleep a worldwide problem. So children who are already sleep deprived, when they start to have sleep disorders, the problem is multiplied. There is also a gross lack of sleep education at an international level. So it's really important to educate yourself about the signs and symptoms of sleep deprivation, the concept of sleep hygiene, and how to seek help for any given set of sleep disorder symptoms. You're not alone. Sleep disorders are a universal problem, and we are here to help.